So I'm really pleased that we've been accepted as a late-breaking abstract at the American Association for Study of Liver Disease 2024 in San Diego for a abstract looking at the follow-up data for the PEDFIC 2 study using odevixibat in progressive familial intrahepatic cholestasis. The original study was a randomized 6-month study, but then the majority of patients went on into an open-label extension. In addition to the original patients, which were just BSEP and FIC1 deficiency, we allowed the inclusion of patients with other manifestations, other types of PFIC, and the small numbers of patients with TJP2 deficiency, MYF5B deficiency, and a few more with MDR3 deficiency. So the real important take-home message is, the most important one really, is that it looks like the responders in the original study have continued to have an excellent response out now for the next 2 years. And we've also shown some response in the small numbers of the other rarer patients, but nothing that we could give any statistical meaning to, but in particular some of the MDR3 patients, who there's quite a few, have had a nice response in terms of pruritus and serum bile acids. I think there's a lot more that we can learn from these data, and I'm looking forward to looking at further analyses and following these patients up for a bit longer, because we really want to know whether we can convert this response that we've seen biochemical pruritus response into long-term native liver survival, and ideally avoid transplantation entirely for as many as possible of these patients. I was really pleased that we had an abstract accepted for the Liver Meeting 2024 for some follow-up studies in the March and March on studies using maralixibat for the treatment of PFIC. And the particular analysis that my poster covered was looking at bile acid response in terms of reducing serum bile acids down to the levels that we previously identified as clinically important in the surgical NAPIT studies. And so far, in its early days, so far the bile acid response, as it's defined in that way, has been associated with event-free survival, and that's most importantly avoidance of liver transplantation. The real data are only a couple of years out from the study, but there is a separation between the bile acid responders and non-responders, but it is not yet statistically significant. Obviously, we still hope that we can convert some of the non-responders into responders, but we almost certainly will have to find other treatments for those in the future. But the most important thing that we can learn so far is that the responders are so far avoiding the need for liver transplantation short term, and that is probably partly in the short term because of the improvement in pruritus, which is associated with the bile acid response. And we know that many of these patients were going to transplant for the pruritus. What we need to see in the longer term is whether it really changes the nature of the liver disease enough so that they do not develop progressive liver disease and will avoid liver transplantation in the long term, which is clearly an objective shared by us and the families.